Can H2 blockers interact with your other medications? Imagine taking a medication for your acid reflux and then realizing it might be affecting other drugs you're using. That's what we're here to explore today. H2 blockers, or histamine 2 receptor antagonists, are medicines like cimetidine, famotidine, nizatidine, and ranitidine. They work by lowering the amount of stomach acid your body produces. Many people use them to treat acid reflux and GERD effectively. But because they change your stomach's environment, they can also influence how other medicines are absorbed and processed in your body. For example, cimetidine is known to have the most interactions. It can interfere with pain medications, making them less effective. It can also slow down the breakdown of blood thinners like warfarin, which could increase your risk of bleeding. Additionally, cimetidine might reduce how well some antidepressants work. H2 blockers can also impact the absorption of nutrients and drugs that need an acidic environment to work properly. Vitamins like B12 and D, folate, calcium, and iron may not be absorbed as well if you take them with H2 blockers. This is why it's often recommended to take supplements or other medications at different times from your acid reducers. Supplements like magnesium should be taken separately from H2 blockers to avoid interactions. Herbal remedies such as St. John's wort can also cause issues when combined with these drugs. If you have kidney problems, certain H2 blockers like famotidine and nizatidine may need dose adjustments to prevent side effects. Medications used to treat infections, especially hepatitis C drugs like Harvoni, Epclusa, or Vosvi, can also be affected. Timing your doses correctly is important to ensure these medicines work as intended. If you're on blood thinners, antidepressants, or other critical medications, always tell your healthcare provider before starting an H2 blocker. They might choose a different medication or adjust your dosage to avoid problems. Pregnant or breastfeeding women should also consult their doctor because H2 blockers can pass into breast milk and their safety during pregnancy isn't fully established. If your symptoms continue after 2 weeks of using an H2 blocker, it's a good idea to see your doctor. They might suggest other treatments like proton pump inhibitors, which are another class of acid reducers. In summary, H2 blockers are effective for acid reflux and GERD, but they can interact with other medications by changing how they are absorbed or broken down. Always talk to your healthcare provider about all your medicines and supplements to keep your treatment safe and effective.